welcome. Please have a seat. Getting ready to begin. Welcome. Thank you all for joining us here. We're very, very happy to welcome you to our session today. It's on traditional Chinese medicine, TCM, optimizing male and female fertility naturally. It's sponsored by our friends at Fairhaven Health, and we thank them for sponsoring the session. One note, there is a living art project being headed up in front of registration, and that will be on display tomorrow. So we encourage all of you to take part in that before the day is over, so that you can see our collective effort together to create that. With that said, I'd like to introduce the panel, and I'll hand over to our moderator, who will introduce the illustrious Dr. Dao. Take it over.
Thank you so much. Hi, thank you so much for being here. Thanks. My name is Wendy Obstler. I'm the moderator today. I am the lead teacher for Strong Yoga for Fertility, as well as a yoga therapist here in Los Angeles. Before we get started, I just wanted to remind you all that we have an online streaming audience as well with us today. And if for some reason you want to reach out to a friend that happens to not be sitting right next to you, to remind them that they can be a part of this as well, to ask any questions. They can ask direct questions through our Twitter feed, which is hashtag FPS13. And if for some reason, as we get into questions, if for some reason you want to stay anonymous in your questions today, you can also send a direct line through the Twitter feed as well. So I'm so thrilled to be here as we all learn more about our topic today, which is entitled Traditional Chinese Medicine and Optimizing Female and Male Fertility Naturally. Before we get too deep into it, just with the nature of who I am and what I do, I want to take a second to give us all an opportunity to get really present here today, to drop into our body and to drop into our breath. So just be with me here for a second. Just take a tall seat. If it's comfortable, you can close your eyes or soften your gaze. And this is just super simple. Just start to feel yourself sitting upon your chair, the weight of your body on the chair. And that the chair is, in a sense, rising up to meet you. So you can really yield the weight of your body down. And then just 3 breaths together. We're just going to take a full breath in through the nose and exhale softly through the mouth. And again, like that, a full breath in and exhale. And one last time, a deep breath in. And exhale. Good. Now opening the eyes to a soft gaze. Thank you so much. So I'll take a second here to connect the dots on how it came to be that I have the privilege to be here at this event today. As I mentioned, I am the lead teacher of Strong Yoga for Fertility. And what keeps me excited about the work I do with Strong Yoga is that we see results again and again. I constantly witness transformation in my clients on this journey. They may walk into a 4-week workshop series that I'm leading completely frazzled by the roller coaster ride that is unfortunately associated with the fertility journey. They are desperate to feel better, but more importantly, to not feel broken. If nothing else, they are leaving that first session having learned to breathe and realizing that they aren't alone. As many of us here know, fertility challenges can bring up the most primal of fears and make us feel completely isolated. But as we move together and breathe together and build a sense of community in our yoga sessions, I get to watch their eyes get brighter. They have regained, even if fleeting, a sense of wholeness. And this becomes a foundation to build on, to help in grounding and relaxing and learning to receive, to conceive. for me, on a professional level, there's no better feeling. It feeds my soul. And on a personal level, well, it gives me a lot of hope because I find myself in the very same journey as you all right now. I've been teaching yoga for 8 years, and although I had taken yoga classes on and off for almost a decade before becoming a teacher, I had never really experienced the depth of what yoga is really about until 2003 when I met Brenda Strong. Brenda's teachings were the first yoga teachings where I experienced the aha moments that make a practice like yoga so rich. She taught me to breathe consciously and how I could use something as simple as the breath as a tool for coping with stress in my life and stress in my body. She inspired me so deeply with her teachings for women that my entire life path and purpose dramatically shifted. I am a yoga teacher because of her. I am a yoga teacher specializing in fertility because of her. And really, I am here today at this event because of Brenda Strong. If you're not familiar with who Brenda is, please allow me a quick introduction. She's the founder and creator of Strong Yoga for Fertility, which includes in-person yoga programs, DVDs, and most recently, my personal favorite, the creation of the Strong Fertility Ball Yoga Method. Brenda teaches at the Mind Body Institute at UCLA, and in 2005, she became the first national spokesperson of the American Fertility Association. She also currently serves on their board. The truth about Brenda and who she is that she is a deeply passionate and present spirit, and truly a pioneer in this field. In fact, Brenda has received an honorary doctorate of science specializing in traditional Chinese medicine for her pioneering work in fertility from Yosan University, which was founded by today's keynote speaker. Strong Yoga for Fertility is something she developed from her own experiences with secondary infertility, as well as her research in working with other women going through fertility challenges. The concept behind Strong Yoga programs and products is to support individuals on our life journey through reproductive difficulties, relationships, pregnancy, and yes, even that naughty word, menopause. But the products and programs aren't just exclusive to women. There's a wonderful DVD of Brenda's called Yoga for Partners, and even the fertility DVD can be performed by men. All of the yoga we teach and much of the ball work can also be practiced by men with benefits. It will help them to have blood flow and circulation moving into their reproductive area as well. Brenda wanted so badly to be here today. This is a subject near and dear to her heart. And our keynote speaker today has been a pivotal person in her life. The short story about Brenda and Dr. Dao's meeting is that Brenda, when she was in her early 30s, had been trying to conceive for about 3 years with no luck. She had a friend who had also been having issues, although the friend's issues weren't in conceiving, but in actually holding those pregnancies. After multiple miscarriages, Brenda's friend found Dr. Dao and soon became pregnant and carried that pregnancy full term. Brenda thought, maybe this Dr. Dao can help me, so she made an appointment with him. On the weekend before her scheduled appointment, she says, this is such a funny story, she was driving home from the movies with her husband, and she realized, wow, my boobs are sore. Could I be pregnant? She said she stopped at the drugstore, bought a pregnancy test, and yep, there it was, a positive result. She says she called Dr. Dao the following Monday and said, damn, you're good. I didn't even have to meet you. I just had to make an appointment with you to get pregnant. Right?
Yes.
He's that good. She asked Dr. Dao if she should keep her appointment, and he encouraged her to do so. And he ended up working with Brenda throughout to help her carry that pregnancy full term. From that, Brenda has a beautiful son named Zachary, who is now about 17 or 18 years old. What's ironic today for me is that this is the first time I've actually met Dr. Dao in person. But you better believe I've heard plenty about him over the years, from Brenda, of course, as well as many, many of my clients. The overwhelming consensus about Dr. Dao is not only is he an expert in his field and a gifted doctor, but he is compassionately connected to his patients. He listens to them. He is present with them. Who wouldn't want that, especially on this journey? So, without further ado, it is my honor to introduce our keynote speaker today. He is the 38th generation in a family lineage of Chinese medicine doctors, well known and respected in his field. He is the founder of Yosan University of Chinese Medicine, holds 2 doctorates in Oriental Medicine, was awarded the recipient of the American Fertility Association's Visionary Award in 2009. He's a member of the American Society for Reproductive Medicine, Pacific Coast Reproductive Society, American Society for Nutrition, and the American Association of Oriental Medicine. He has co-authored The Dao of Fertility, a healing Chinese medicine program to prepare the body, mind, and spirit for new life. He's been featured on NBC's The Today Show, Conceive Magazine, Conceive on Air, Women to Women, The Donnie and Marie Show, Our Magazine, Home Show, and numerous other television interviews. He practices at his clinic, The Dao of Wellness, in Santa Monica, California. I give you Dr. Dao.
Oh my God. It's a great honor for me to be here today. And the truth is that I'm in existence because of my patients. A lot of my patients who go through so much journey of trying to get pregnant, it's a very difficult journey. And I think I see it as I'm a partner on this journey. I'm a facilitator, I'm a helper here, and to help my patients to become successful in their pregnancies. So there's one thing to really begin with. My philosophy really is to really have a plan. When I work with my patients, I try to help them to devise a plan on how to go about in achieving a pregnancy. Pregnancy is really not your end goal. Pregnancy is really only a process. The reality is at the end is that you want to have a healthy baby. You want to have a healthy mother at the end. You don't want to get pregnant and completely destroyed your health and totally wasted and completely tired. By the time when the baby comes out, it's a really anticlimactic situation. So a lot of times I try to help my patients to really go through this journey in a much more thoughtful way, in the sense of going in the long term, in the sense of what's the end inside. The ending objective is really to have that healthy baby while your health is intact. So that's the first philosophy that I have. And the second philosophy is to have a plan. A lot of times it's very difficult to go through endless IVF or inseminations. Or each cycle, I can say, is precious, but a lot of times for a lot of patients, each cycle when you get a menstruation is very painful to go through. So a lot of time in the short term, to deal with this short-term pain, you have to have some long-term idea on what you need to do to achieve that pregnancy. So that's the second philosophy I have to try to help my patients.
Beautiful. Yeah, and it's along the lines of what we do in our yoga programs as well, to set people up to have tools for regaining health or maintaining really good health. And the health, of course, of the body, but also the health of the mind and the spirit, because we really can't separate any of those areas of ourselves. So. Beautiful. So we will jump in with some of our questions. I wanted to ask a few questions that, I feel like I'm up here really representing the patients for sure. So one of the questions that people ask about traditional Chinese medicine and acupuncture and natural optimization is, can it actually improve the quality of eggs and sperm? Can it have a positive physiological impact on the ability to conceive and carry a pregnancy to full term?
Okay. The short answer is an absolutely yes. The long answer is, first of all, I want to know how many people actually here don't really know what traditional Chinese medicine is. Good, we have a few people, so it might be a good idea just to go through really quickly. Traditional Chinese medicine is a 5,000 years old medical system. And don't forget, this is a place in the world where Western medicine hasn't existed at that time. And so in the Chinese history, Chinese medicine is the only thing going, and that's the only medicine that basically uses acupuncture, uses Chinese herbs, herbal therapy from the planet, from the environment, and even some minor surgical techniques. So it's a pretty integrated, a very strong and very thought out medical system. For example, just herb-wise, there's about 5,700 different herbs that's used in Materia Medica that's sanctioned by the Chinese government. So it's a lot of herbal medicine. You can see herbal medicine is like the drug in this country. Acupuncture is almost a little bit like a surgery, but it's different than surgery that is in Chinese medicine. So there's a lot of different other things such as tuina, such as massage, such as cupping, maxa. There's a lot of little therapeutic treatments that you can use. And the whole concept of Chinese medicine it's a little bit different than Western medicine, is that it stimulates your body to heal. The Chinese medicine believe that our system, our body, it's a little universe and it can function quite well. When it goes through out of balance, when it goes through dysfunction, that's when we get sick. So just by nudging our body, doing some acupuncture, taking some herbs, that help our body to get back to some functionality. So intervention is much more collaborative with your body. It kind of nudges your body. It's like a little needle on the thorn on the side. Say, hey, hurry up, get well. And that's what the acupuncture does. That's what Chinese medicine does. So in applying to fertility, and especially with egg quality, Chinese medicine and acupuncture is really effective and very helpful. One of the common scenes that I go through every day in my practice is a lot of patients that come in who don't have a lot of eggs, a lot of follicles when they stimulate, or they have high FSH, or they have very, very low AMH, anti-mullerian hormones. And a lot of times, the key is to really strengthen their foundation, help their ovary, so that they can produce good quality eggs. So a lot of time after the treatments, you will see several things that happen. One, the egg quantity actually increases quite dramatically for a lot of these patients, or the egg quality improves quite well. And so that you can literally see, and a lot of reproductive endocrinologists actually see because they use ultrasound, and they can see how a patient is stimulating. So it's the proof is there. How it exactly does is that I believe that the Chinese herb and the acupuncture really provides a lot of blood flow to the ovaries, as well as a lot of nutrient to help your body to build that foundation. So, a lot of times we say, well, we are born with this amount of eggs we have. The truth is those eggs, sometimes as you go through your life, you might be stressful, and your egg might be weakened. And a lot of times you don't stimulate well, you're not ovulating very well. The Chinese medicine fortifies that foundation, fortify the nutrient, the nutrition, help your body to get strong, help your ovary to get strong, so you actually ovulate much, much better quality follicles and eggs. So.
Beautiful. So it's really about balance, homeostasis in the body, getting to a place there. Along those lines, you kind of mentioned, egg quality and that type of thing, but do you also find it beneficial, acupuncture and traditional Chinese medicine, in terms of people with high FSH or endometriosis or recurrent miscarriages, or maybe just being a poor responder?
Yeah, the high FSH situations and AMH being very low and poor responder is an every hour thing that I treat in a patient population. And it's a very common situation, especially with advanced, we call it advanced maternal age. As we get older, our peak fertility for women is somewhere around 25 years old. So a lot of time when you get to 30, your fertility rate is already come down quite a bit. When you get to the 40s, your fertility rate is somewhere in the 5 to 10%. So it's quite dramatic when you get to the 40s. So I deal with a lot of 40 years olds because this is a more challenging population. So I help a lot of women go through this process. And so Chinese medicine can be really helpful. For example, people who have high FSH, we can lower it. But lowering it doesn't really do the work. You have to do several things. You have to lower it. You have to see how the estrogen level has to stay constant. You have to see whether or not the cycle is regular. That's very important. A regular cycle is the key. You have to also look at follicle count. The follicle count is also important. So there's several things that I look at besides the FSH moving down. And another thing is that it's not also moving the FSH level down. When you move the FSH level down, for some people, it'll jump back up. So a lot of times you have to take the opportunity, okay, I can move the FSH down, but how long that's going to be? So a lot of times you have a short window to work with this patient and try to get them pregnant during that short window of time with the FSH down. So there's a lot of little things that you have to look at and how you navigate through the course. I was just watching Planet Earth the other day on Amazon River, and you know how it just curves. And I think sometimes fertility issues, the journey is not a straight line. A lot of times it's curves. And you'd be so surprised the curveball that I get. And I look forward to that.
It's a challenge for you, huh?
I like challenges.
Yeah, that's what I thought. So, you know, in terms of people having all these different types of issues, do you treat specific people differently then, very specific to them?
Yeah, everybody's it's different. I can tell you, I've been in this field for about 30 years. This is my 30th year in practice. Thousands of people I've helped. One of the things that I see is that every day is a new day. Every encounter is a new encounter. It's not about yesterday's work. Yesterday's gone. Okay, today is a new day. So when I look at a patient, when a patient comes and see me, yesterday is gone. What do I do today? What do I go forward? How do I make this today better? So a lot of time when they come in, when I write prescriptions, when I write herbs, or when I do acupuncture treatment, I think about, okay, what kind of herb I'm going to tweak in there? What kind of dosage? I might change one, change two. So a lot of times it's kind of hard to actually see me using the same formula twice for any patients. Even the same patient, I tweak it from time to time. I change quite a bit, so it's not, and patients go through a lot of different things. Like this month, a lot of people have cold and flu. So you have to change a little bit. When you have an infection, it's harder on your pregnancy. For some women, it's actually easier to get pregnant for some women. So it really depends whether or not they're immune compromised or not. So then you have to kind of fortify, you got to change your treatment a little bit. So that literally there's a little bit of moving target, as you can see.
Yes, definitely, definitely. So I do want to open it up to our live audience here and just ask if anybody has any questions they want to propose to Dr. Dao. Here we go, right in front.
Good morning. You mentioned about...
Can you speak a little bit more into? Thank you.
You mentioned that there were some opportunities for the Chinese medicine method to increase the egg quantity. But first you mentioned that people are born with a certain number of eggs. So is it that people are born with a certain number of follicles, and then once you've stimulated all of them, that's it? Or are you saying that you're regenerating something? Or I'm not really clear what you're talking about.
That's a very good question. You were born with a certain number of eggs, but a lot of times there's a lot of wastage. So what it means is when you go through life, some of the egg don't mature. Some of the egg never come to fruition. Some of the eggs stay dormant. Or that you can go through menopause and you have wasted. Could be hundreds, thousands of eggs or 1,000 eggs. It all really depends. So, and a lot of times, this is like, I always say that every cycle you are going through a Miss USA contest. So, you know, when you're young and you might have 15, 16 follicles, but your body really only choosing one to become the Miss USA, and the other one kind of will die. It's a little unfair world. But as you get older, what happens is that some of these follicles you have in your ovary never really grow or mature, never come up, and never showed up. And you might have these follicles. So what I do is I literally trying to see if I can find you follicles in your ovary. It's like guys who have too many pockets, and there's some coins here and here and here, and you can't find it, and you need your wife to go in and find coins here and find money over this side. All of a sudden, one day you say, oh, I got $20 over here. Same thing. That's what I'm trying to do. I'm trying to actually help your ovaries to actually facilitate and bring those follicles forward. Now, to do that requires your body to be healthy. So I always say the fundamental process of helping your body to really have the most efficient and productive or reproductive ovary is really, you gotta have good health. So that means I always work on the nutrition. You gotta start eating right. The sweets are really one of the hardest things. Every time when you eat a lot of sweets, it causes your insulin level to just go up. And what the problem with insulin level is that it kind of dampens your own hormones. So that's a problem. When you're overly stressed, your stress hormone goes up. And your body is very smart. When you are very stressed out, guess what happens? Your body says, hey, you're in a fear, fright mode. You're not suited to get pregnant. So a lot of times, I always say the lazy one gets pregnant. And you have to be also eating right at the same time. So it's a little paradoxical, shall we say. I hope that answers your question.
Yes. So are
We
there
have
any...
one more question over here.
Yeah, there we go.
I love acupuncture. I've been doing it actually for about 6 months to get my cycle back to normal, and it worked remarkably. It was amazing. My question to you is, would love to continue to kind of keep working on it. We're still having some other issues, but what is your, on average, how often should people seek acupuncture treatment, or is there a start-stop time, I guess? Does that make sense, that question?
Yeah. I always see that a lot of times, first of all, when a patient comes and see me, a lot of times, especially for reproductive medicine issues or trying to get pregnant, a lot of times she wanted to be pregnant yesterday. It wasn't today. So there is a certain amount of urgency. I need to take that stress away from the patient, and I need to find ways to really quicken the process if I can. So let me put it this way, I want you to be less stressed, but I want the stress to come to me instead. Okay, so what I do is I can manage that stress for my patients. I can help to manage that. So in some ways, it really depends on the patient. If somebody who has advanced maternal age, if you are 38 or above, and I usually would start out twice a week, and then we'll see how the patient's going. If their cycle is so irregular, I will see the patient twice a week. And if we're really working on those regularities and we get things to a very good regularity, then I'll cut it back to once a week. Okay, but if you're over the age of 42, I push really hard. I usually see a patient twice a week because she's supposed to be pregnant yesterday. So a lot of times I look at my target and look at whether or not we can really achieve that. And also, don't forget, when you do acupuncture, make sure you're also doing some herbs. The herbs is wonderful. It really, really help. And that's a real integrated part of the Chinese medicine. It tastes wonderful. You should really try it. I think I lied on that one, did I? Yes.
We have another question right here.
Yes.
I actually just wanted clarification because you just spent a few minutes talking about FSH and AMH, I think you said.
Yes.
And I don't know what any of those mean.
Wonderful. AMH stands for anti-mullerian hormone. It's a hormone your body produces, and it's in the last 2 to 3 years, a lot of reproductive endocrinologists start to test that number, to test that hormone. And really, you want that hormone to be above 1. Ideally, in the best world, really fertile, you want a 4 or above. But my patient that I treat, it's great if I can get anything above 1. So a lot of time I'm looking at 0.50. So the lower the number means the lower your ovarian reserve, the lower your probability of your fertility potential. So that's the way you can interpret that number. Okay. Having said that, I just have a patient whose AMH is 0.17, and she's now at 12 weeks. We help her to get pregnant, she's at 12 weeks and she's done. She's on her way to become a mother. Genetics are all normal and all that. So I don't want you to feel that when that number is low, it means end of the story. It's not at all. You have to take a look at many different factors.
What was the FSH?
The FSH is follicular stimulating hormone. Okay, that's a hormone that your body produces from your pituitary that stimulates your ovary to produce eggs. So it's a reflective number. So what that means is if that number is elevated, it's a reflection that your ovary needs some help. It's like your body's sending a lot of messaging down when your ovaries are lazy. It's like, come on guys, work, go to work. You've been in Hawaii, gone fishing, you need to get back to work. And that's what the FSH is all about. So the higher that number, it means your ovaries are lazy. Okay, so that's the way you can interpret that. I hope that helps.
And another question here.
Yes.
Hi, I've been doing acupuncture for almost 3 months now, and I started herbs almost a month ago. And I have a high FSH and no cycle. I haven't had my own cycle in years. Is acupuncture going to help me?
You have no periods, right?
No.
Okay, so your question is, you have an elevated FSH and you have no menstruation, obviously means no ovulation, whether or not Chinese medicine can be helpful in this situation. It can be, really depends on how long you haven't had a period. There are patients who has missed their cycle and is 1 year or 2 years, we're able to bring them back. It also depends, the FSH levels tells us if your FSH level is in the 80s, in the 90s, and then that's going to be hard because that's basically, your body is really on the borderline of menopause or what we call a premature ovarian failure. But if your numbers are somewhere, FSH is somewhere in the 20s, somewhere in the 30s, even 40s, I see that anything below 50, there's a chance you can still try to work on that and trying to bring that number down. But when you get to the 80s, it's getting harder, much harder.
I'm sorry, Dr. Dao, can you just restate her question so the live audience can hear?
Okay.
Or actually, we have the mic back. Ma'am, if you could just restate the question, thank you.
Yeah. I said that I have a high FSH and no cycle, and is acupuncture and herbs going to work for me? And I was diagnosed with premature ovarian failure.
Yeah, that's what I thought that you were saying to me.
Yeah.
Yeah, so as I say, again, I'll reinstate. It's when your FSH is in the 80s, 70s, 80s, or 90s, that's going to be really hard. But when your FSH is below 50, I think there's still a shot at it.
I'm over 100.
Okay.
So she was saying she's over 100. I'm just restating so everyone can hear.
Yeah, so that's going to be hard. That's going to be quite hard.
So I want to just shift to our Twitter feed or our live stream if there's any questions. Yes?
So Dr. Dao, you're quite popular online. So I'll start with our first question that was early in. Dr. Dao, how can Chinese medicine improve a woman's ovarian functions? Any natural remedies and tips from Chinese medicine?
I think your question is how does Chinese medicine improve ovarian functions? Is that right?
Yes,
right.
it is.
Okay. What we have found is that a lot of times, especially in people who don't ovulate properly, and sometimes you have people who, you do those P tests, right? Everybody's familiar with that P test, where you check for ovulation time, and that thing just doesn't turn positive. These days, I don't know whoever come out with a smiley face, supposed to smile back at you, right? And they don't smile, not smile, they don't smile. Oof. English is a difficult language sometimes. It doesn't smile back at you. So sometimes it actually means that your LH is probably a little bit low, or the time that you test it may not be the right time. I usually tell my patient, just do it in the afternoon about 3 or 4 o'clock, and some women actually test better. But there are situations where it actually means that your ovulation is actually, the process is a little bit weak. The hormonal, the LH surge is kind of, it's not robust. You need to be strong. And so a lot of times that's one indication that the ovarian function is a little bit weak. So a lot of times we're trying to work on the ovaries to help them to have a stronger ovulation.
Can you clarify LH just for people who may not know what that means?
Great. Luteinizing hormone, it's a hormone that you secrete. When your egg grows to a certain size, that hormone gets secreted from your pituitary, get the egg released, get a follicle released from the egg, gets popped out, and then the follicle comes out. Yes.
Beautiful.
So another question from our online audience has to do with how to find good or sound or qualified acupuncturists, Chinese medicine healers or doctors in areas that maybe aren't as metropolitan or in other countries.
That's a very good question. This is a very specialized field. I think it's important to find somebody who actually have herbal experience also. Just being an acupuncturist is not really enough to really work. There's just so many different facets of reproductive medicine that you really have to know. So that's the very first thing. The second thing is that this person probably should be in practice for quite a while. I would say at least 5 years, and has gone through some training. For example, Yosan University have a doctorate degree program in reproductive medicine. People who has gone through those kind of training is going to be much more suited or more prepared to take care of much more difficult issues in reproductive medicine. But having said that, majority of acupuncturists can really treat a lot of facets of fertility problems because that is something that's part of their training program, that you're trained to actually deal with OBGYN issues and you deal with a lot of fertility issues. But there's also an organization called ABORN, the American Board for Oriental Reproductive Medicine, aborn.org, I think, or .com. You can go check it out there. Those are the people who have to go through some certification and testing, so they are probably has gone through much more training as well.
Very good. It looks like we have more questions from our audience. Just allow a moment for our stage manager to get back into the audience.
Yes, I think some people in the front just wanted you to say again the
Oh,
ABORN.
ABORN is ABORN, ABORN.org or .com.
So we do have a question here, and then we'll get to your here in front in just a moment.
Thank you. Thank you for sharing your thoughts today. I'm curious if you have a Chinese medicine perspective on exercise, because I think one of the things that becomes contradictory in this whole journey is that you've used exercise for stress relief, and now you're almost kind of being advised, dial it down a lot. And so it's a real challenge, and I just want your perspective as to kind of what's a substitute or what you recommend, and recognizing obviously that everybody's different. There's an individual approach for everyone.
I think this need to take an individual approach. If I'm treating somebody who exercises vigorously on a regular basis, I'm going to reduce some of the intensity. I'm going to try to devise a plan where the patient can still exercise, probably just not as vigorously, and also it depends on their what we say body mass index or their weight. If they are very thin, I'd like them to quote unquote fatten up a little bit. I find that fertility works better when you are a little lazy and a little fat. I hate to tell you this, it works better. So if you're a little bit fat, be happy. But if you're very thin, and sometimes it's just constitution. There's just some people who's very thin. When I was seeing patients in China, everybody's thin. So that's different. But it's very interesting when you go to China, when you see patients, they are thin, but you know they're actually overweight in the Chinese term. So you have to see in a very different light. So come back to exercise. Basically fertility has to do with management of your energy. Your energy resources have to be managed. So if you are doing a lot of exercise, that might not be so good for you, especially very vigorous ones. And it all depends on your body type. So we have to take into a lot of consideration into what's going on with that individual.
We have another question here.
Hi. Aside from sugar, are there any other foods to avoid or eat more of on a nutrition basis that would?
One of the things is I think one of the things is to start with by looking at food. The very first thing is make sure you have regular meals. Regular meals is so important. If you start to skipping meals, your blood sugar goes up and down quite a bit. I don't think that's really good for your body. and that's not very good for your fertility and ovulation to start with. I usually try to ask my patients to really keep the sugars at bay if it's possible, and I know it's really hard, and to keep the caffeine down, keep the alcohol away. Alcohol is just another form of sugar, basically. And also no icy cold drinks. The reason for icy cold drink is that it competes with your circulation. We need that little micro circulation into your ovaries. And when you're drinking a lot of cold stuff, your body circulation changes. You have to come up a little bit more instead of going down there. So I encourage people to eat a lot of green vegetables. Fish is wonderful. And just have a moderate diet. You got to make sure you have protein, got to make sure you have fat, you got to make sure you have carbohydrates. So you got to make sure you have a very balanced diet. So it's not about eating something so much. I have a patient who say, well, you know, if goji berry helps me, I'm going to eat a whole bag every day. I say, no, it's ridiculous. It's too much. It's more all about moderation. So I think that's the key.
Is there a certain diet you would recommend?
Is there a certain diet Dr. Dao recommends? Sorry, that was the question, just jumping into so the live audience can hear.
Yes. It's not about diet that I recommend. It's healthy eating that I recommend. I don't think diet is really that good. Now, there's one place that I use this diet. If somebody who is, shall we say, severely obese or moderately obese, I would actually go through some detox diet. That's the time. That's the only time where I would get people to really detoxify. Or if people who eat poorly. I have some patient who, you know, eat chips, potato chips every day, drink Guinness beer, and, you know, I have an Irish patient who loves Guinness beer, drink Guinness beer, potato chips. And so a lot of time those kind of situation, you would do a little detox diet, and you need to do that. Otherwise, most of the time, I really encourage people to eat healthy. And healthy means you don't necessarily have to be vegetarian to be healthy. And in fact, this is one of the debate. And a lot of times, being vegetarian sometimes are not so healthy. My mom is a vegetarian, and whenever I go to her place, her friends who is vegetarian, they are all eating so much sweets, and they are all overweight. I mean, that's not so healthy for them. So a lot of times, it's not about being a vegetarian. It's more of a healthy diet, moderate, healthy diet.
Okay, we have a question here.
Thank you. My name is Mary Goyer, and I work in holistic fertility, and my interest is in, my background comes from,
Speak into it.
thank you. My background's in marriage and family therapy, and so I focus on the emotional and mental side of fertility. And I'm hearing a lot of talk about the stress reduction, but I'm just curious what you prescribe to your patients on that end of it, in terms of really getting that support and all of the ways that that impacts the body.
Actually, I see a lot of patients who actually, because of fertility, actually has anxiety. So one of the things that I teach them is I actually teach them Qigong. I teach them some breathing exercises. I have them take some classes that can help get them to take some walks, do some meditation. That can be very helpful. Now, if they have some issues where that they have a lot of time relationship issue occurs, and also that if they have a situation where they just couldn't get out of it, I usually would ask them to see a therapist, for example, so that can help them to kind of download, vent at somebody, or whatever you do, just go see a professional who might be able to help you, go to a support group, that kind of things. So I do that quite a bit with a lot of my patients.
Hi, my name is Jackie, and Dr. Dao did not ask me to talk, but I am a patient of Dr. Dao, and he has helped me in the past 3 months remove the stress. I'm 42 years old. I've been trying for 1 year, and he's an unbelievable doctor, and he's helped me through acupuncture, through his Chinese herbs, and I go there every week, and I look forward to going to see the doctor because he changes your outlook completely. Instead of being stressed and having anxiousness and saying, oh, this month I got my period and it didn't work, he makes you feel like, okay, that was yesterday, let's move on till tomorrow. And I respect you very much, doctor, and I'm honored to be here.
Thank you.
Thank you for sharing that with us. That's really lovely that you did.
So I just wanted to check back in just to see if we did have any other
Yeah,
online
we have another one right here.
Oh, okay.
Hi, Dr. Dao. You talked about the LH results on the OPK test. What's the most opportune time to have intercourse after you get the LH surge on the OPK test?
The LH test you can do in the morning. Most of the time, your luteinizing hormone is strong enough that you should be able to detect in the morning. If that doesn't work out well, I would suggest about 4 o'clock, 3, 4, 5 o'clock in the afternoon, basically after lunch. So you can do it at that time too and try that out and see how that works. And sometimes people who doesn't test positive in the morning will test positive in the afternoon. Actually, I had a patient who was testing at midnight. I don't think it's a good idea. I want you to sleep. Oh, that's another thing you brought up. Sleep is very important. So I always request or ask my patients to really sleep about 7 or 8 hours a night if that's possible. So I hope I answered your question on the LH.
Yeah, I just wanted to re-clarify the time after you get the positive result on the OPK test, whether it's in the morning or the afternoon, after you receive that positive result, is it 24 to 36 hours that you should have intercourse after that to make sure that it's the opportune time for pregnancy?
Okay, you're asking the intercourse time. The way that I do the intercourse time is not by the OPK. It's by your mucus, if it's possible. If not every woman can detect mucus, so it's not for every woman be able to do that. But if you can, you start having sexual intercourse when you start to have mucus. And that usually occurs about 3 to 4 days before you ovulate. And the reason for that is that that mucus is preserving, is protective. So when a sperm comes in, that mucus, if it's not hostile, it preserves the sperm and it helps the sperm to function better. And it kind of helps the, shall we say, it's kind of like an escort. It escorts the sperm up the tube to the place where the egg resides. So I frequently tell my patients that stick is a barometer, but it's not really to tell you exactly when you really have to have sex. So a lot of times and it gets very stressful when you measure it exactly on time. So what I usually do is start having sex, start having love making when you get your mucus, and then just spread it out. Do it every other day. You don't have to do it every hour. I mean, that's a little stressful, especially for the guys. We do not perform on demand. Do we? I don't know. I got to think about that. But you want to do it, every other day would be fine. You don't have to do it every single hour, every single day. There's no book that tells you. There's no evidence that's going to make you more pregnant than the other. So that's what I would suggest my patients. I hope that helps.
We do have a couple more questions here in the live audience. There's one right here, third row. I love that we're getting so many questions. I think it's so helpful.
My question kind of goes along with what you were just talking about. I've been doing acupuncture as well. Do you suggest, or does it make a difference if the man, will that help with mobility and sperm count? What is the best approach for the man to go holistically?
Man, you have to ask about man. Semen analysis is the first thing that we usually do with men. And a lot of times, if that semen analysis is poor, then we go through a lot of different evaluations to see if there's other issues. But a lot of times, it really takes two to tango here. So it's not just the quality of the egg that's important, the quality of sperm is equally important. There's a lot of study and research shown that if your egg quality is good, but if your sperm quality is not so good, you're going to have a poor outcome in your offspring. So sometimes, a lot of times, we actually counsel on men on eating better, on having a better lifestyle too. So it takes two, it's a teamwork here. I said earlier, it's really a teamwork, and so it's very important that the man gets evaluated. Having said that, I usually look at the occupation of the man, the stress, the factors, and look at the health status of a man. And a lot of times, all you really need is an evaluation for the first visit. If everything looks well, we give them some advices, maybe give them a little treatment, and a lot of times you don't need to do too much with a man except to really have a good lifestyle. Otherwise, there are issues there. The Chinese medicine is very helpful for sperm parameters. Frequently, we see people who has low sperm count, low sperm mortality and morphology as well, and people who has what we call DFI index, sperm fragmentation issues. So we see a lot of these problems, and Chinese medicine can be very helpful in this situation.
I think we had
I answer your question.
Sorry. I think we did have another question. Was this right? In the, yeah, up. Thank you.
It was kind of along the same lines, if you could speak more about male factor in fertility and whether, I think you did mention that even if there was no sperm count, that Chinese medicine could improve that. Sure. My question was along the same lines as the previous question, if you could speak a little bit more about male infertility, and I think you mentioned that even if there was no sperm count, sometimes the Chinese medicine could help, or
yeah, low sperm count is a lot of time can be improved. No sperm count is much harder. It's hard to make hay out of nothing. It would be great if you have something, and a lot of time depends on what kind of no sperm count issue. There is what we call obstructive azoospermia and then a non-obstructive azoospermia. If it's an obstructive azoospermia, it means that the duct, the vas deferens, probably have some blockage. And if there is some blockage because of inflammatory activity, that's where Chinese medicine can really help. But if it's something that is scarred over, then you have to do some surgical intervention to get the sperm out of the testicle through a surgical procedure called TESI.
Beautiful. And we do have a live streaming question.
Yeah, we have actually quite a few questions. We're competing with the room. So somebody has asked about PCOS, polycystic ovarian syndrome, I think is what that stands for, and whether Chinese medicine, traditional Chinese medicine, TCM, can help.
PCOS has gotten a lot of attention quite a bit in the last 20 years. Polycystic ovarian disease is a condition where the ovaries has a lot of bubbles, a lot of follicles, a lot of bubbles that actually don't mature, don't do anything, and don't ovulate. And a lot of PCOS patients have irregular cycles. They don't ovulate very well. Chinese medicine, no different than treating other patients, is very similar, very much of the same approach. Your goal is trying to get that cycle regulated. So we would use the same kind of approach in different pattern. We look at different pattern and look at different herbs, different acupuncture treatment. We would treat it very similar ways in dealing with PCOS to trying to get the patient ovulating. That's the key, to get them to have a regular ovulation. Once they have regular ovulation, it tends to get pregnant pretty quickly when they get that. Now, there are PCO patients who has regular ovulation and just don't get pregnant. Then you take a look at the insulin issues, see if that person has insulin issues and obesity issues. If there's obesity issue, we try to help the patient to detoxify and lose some weight, and a lot of time that can be very helpful.
Do we have any other online questions you want to ask?
Let's see. Actually, the cost of treatment has come up a couple of times, a bit of a recurring theme. Maybe you could address that?
The cost of treatment, it depends on basically where and who you see. The fees can be very low, can be high. So in my clinic, our fees for acupuncture, for example, is $75 to $130 per session. Depends on who you see and their experience. For people who couldn't afford that, I'm a founder of Yosan University. We have for example, a subsidized nonprofit community integrated fertility clinic on Sundays, and is at a much, much lower fee. And if the person cannot afford that either, don't even have any money, they can go to Venice Family Clinic, for example. Yosan University have interns there, actually treats patients there. I believe was Saturday, there's also another shift, either Wednesday or Tuesday, that we see fertility patient there too. That is for free, basically, for people in poverty level.
Wonderful, wonderful. So I wanted to just ask one final question that may be coming up for people, which is, in your experience with working with people, do you find that Western fertility specialists also believe in traditional Chinese medicine and acupuncture? And do they like to work with someone such as yourself, with a patient?
I am a member of the American Society for Reproductive Medicine, so I sit next to them. And I was invited to the SARS Society for ART to actually teach them about Chinese medicine about 15 years ago. So I'm a very active member. I'm there all the time, and I see all the same research as they do. So a lot of time when they're doing the stimulation, I know most of the time what they are doing and what they are supposed to see. So in some ways, I function as a collaborator to really help them. And a lot of time they do embrace Chinese medicine quite well. And the whole goal at the end of the day is really our patient. We want our patient to get pregnant in the most efficient, the quickest, and the least harmful way. So a lot of time, whatever we can do, and there's some patient who needs IVF, who needs insemination, I would refer these patients and to the doctors, to the REs who can do such a treatment for them. So it's a collaborative venture. And our goal is really the patient has to get there as quickly as we can help them.
Wonderful. I have a question. You mentioned the taste of herbs being so bad.
I didn't say that. I didn't say that. I say tastes good.
I'm curious if it makes a difference if the herbs are ground down enough, if a patient were to cap them themselves. Does that make a difference in how the body is assimilating it?
Yeah, there's two kinds of, there's actually three kinds of herb, but really two main kinds that you really want to take is the customized powder and the customized raw herbs. We tend to like to use the customized raw herbs. That's in the most natural state. And the reason being is that when you do a powder process, it's a GMP standard, good manufacturing standard, 10-step process to come up with a powder. You basically have to take 10 portions of a powder to make one portion, 10 portions of the herb to make one portion of powder. That whole process, sometimes you lose some ingredients in there, okay? And that, in the raw form, you don't lose anything. You capture, at the end of the day, everything in that raw tea. So a lot of times, that raw tea is going to be more potent than the powder in a general sense. Now, if somebody who have a chronic illness, we then, a lot of times the tea might be a little bit more troublesome, and the chronic situation, you can go to the powder and that would be fine, or the pills, etc.
Okay, thank you. Along those lines, just for people who have never experienced acupuncture, do the needles hurt when they go in or come out?
The acupuncture needles don't hurt at all. Most of the times, it's basically like a little pinch. It's, if you put your nail on your skin and you push it a little bit, you feel that little pinch, that little pressure. That's most of the time you feel that. And a lot of times when I put the needles in, we leave the needles in, and a lot of times most people feel very relaxed. So you don't really feel much pain or discomfort. There are some times that we might have to manipulate needles, depends on conditions. So say, for example, I might treat an endometriosis patient who are in a lot of pain during their period. So sometimes I have to manipulate a needle. Because they're in so much pain, when you do the needle, they actually like it. They feel actually better, and you actually feel a little bit of, not discomfort, you feel a little tingling and a little bit like a nerve feeling, and that actually gets rid of the pain. So a lot of times acupuncture, it's really comforting and relaxing.
Beautiful. I've noticed in my own experience with acupuncture recently that sometimes a needle will go in, I don't feel anything, and sometimes I'll feel something and I'll actually feel like movement of some kind. Can you explain what that is?
Yeah, a lot of time, well, your whole body is got so many different nerves and different systems. So when you put the needles, the whole theory of acupuncture is when you put a needle in a point, we call the point, an area called point, it solicits a response. And that response can be your nerves. So you can feel that nerve sensation, or your circulation, or your lymphatic system, or your hormone system. So there's a lot of responses that it actually solicits. So a lot of time when you feel that sensation in Chinese medicine, we call that qi flow. the energy is flowing in, the qi is flowing. That's what we call the qi, not cheese, qi. Qi is flowing. Okay, so that's what you feel.
Beautiful. Thank you so much. Well, I just want to wrap it up here today. I first want to thank all of you for being here, as well as our online streaming audience. And I wanted to just remind you to please share your views and continue the conversation with us on Twitter and on Facebook, #fertility or #FPS13. I want to let our audiences know that all the programs here at the event can be viewed on fertilityplanet.com for free all weekend long, and then on demand starting this Monday, January 14th, for an entire year. So please invite your friends if they weren't able to be here today for that. We'd like to thank Ustream for recording all the programs featured here at this weekend. I want to thank Dr. Dao for being here and sharing your experience and your advice. And I also want to thank our sponsor for the session, which is Fairhaven Health, for supporting the conversation today, traditional Chinese medicine, optimizing female and male fertility naturally. Thank you so much.